Welcome. So I'm going to explain a little bit about shockwave therapy, where it came from, what it does, and what is the difference between the two major kinds: focused shockwave therapy, which is what we have right here, and radial shockwave therapy or radial pressure wave therapy. So starting off with the history, where did shockwave come from? A little bit of a hairy story here. So shockwaves were discovered after World War II or during World War II, when they were looking at the bodies of people who died near where bombs had went off. And there was no signs of external trauma. When they did autopsy, they found out that the lung tissue had been severely damaged by what we now call shockwaves. So fast forward a few more years, they were looking at if there was a way to harness these shockwaves, decrease the strength of them, and use them for something. And so they started with animal studies in the 1970s in Germany. By the 1990s, there were some research going on about how they could use shockwaves to dissolve kidney stones. And then from there, that worked very well in dissolving kidney stones. They were looking at stones in the urinary bladder. And so they decreased the force of those shockwaves more from the kidney stone levels because they were worried about the reproductive organs in that area. And they found as a side effect that it was causing bone density increases, soft tissue muscle regeneration. And that's how most of the uses of modern shockwave have been born. And shockwave is absolutely still used for dissolving kidney stones at a higher level than we have in our office. So the one that we have is good for muscle healing, increasing bone density, can help with non-union fractures, can help with scar tissue. And really its powerhouse is helping dealing with like chronic injuries like tendinopathies, whether it's, Achilles tendinopathy is a really common one, rotator cuff tendinopathies, rotator cuff tendon tears, high hamstring tendinopathies, plantar fasciitis. Those are some of the big things that we see research on shockwave helping. So what a shockwave is it's a big, strong acoustic sound wave that goes in. If you think of the cell like a bubble, it's taking that cell and it's giving it like a little smush. You get that balloon coming in, and that squeeze, we call it mechanotransduction. It is getting transducing that mechanical movement into getting the cell to signal for cell proliferation, causing cell regeneration, helps with angiogenesis, rebuilding blood vessels in an area to increase blood supply so that it can heal, increase collagen production. So basically it rejuvenates the tissue. There's two kinds of shockwave therapy, and the one we have, focused shockwave, is more of the true shockwave therapy. It is stronger. It's called focus because basically it comes out from a wider surface, but it focuses, if you can think of it coming towards a point, focuses into a point deeper into the tissue. So you can get a couple inches into the tissue with the most focused little beam of it. Think of it as maybe like a little Sharpie marker drawing inside the tissue. That's the area that it's affecting. So we can get deep into the shoulder with it. Radial shockwave, on the other hand, basically it's coming out and kind of like a shower head. It's spreading out from there. So it's dispersing as you go deeper. Instead of it becoming more concentrated and stronger, the shock waves are becoming more dispersed and weaker. So it works better for more superficial, muscle hypertonicity, plantar fasciitis. That is nice and superficial trigger points in the area. So those are the two big differences. While I have it here, let me show you how the shockwave works. All right, so I've got the shockwave on moderate level. This is at 6. I'm going to be doing shockwave on my foot. I injured my foot about 2 months ago. I dropped a 25-pound weight plate on it. I did not break any of the bones, but I definitely sprained the ligaments through my foot as my arch did like a quick collapse and came back, had bruising all over the bottom of my foot, and I was on crutches and in a boot for a while. So similar to an ultrasound, we use ultrasound gel to transmit those waves in. And basically I've just put it on, and when I turn it on, and just like I'm spreading the gel around, you'll probably see my face cringe. It hurts just a little bit. And you'll hear the tick, 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 and those are the shock waves. So here we go. It is, I would say it's a little bit uncomfortable, and that is typical for shockwave. It definitely hurts more over bony surfaces, and feet are, they have a lot of bones that are not too superficial in them. I'd say like when I use it on scar tissue, like C-section scar, it doesn't typically hurt. Probably a lot of nerves are severed in that area as well, so you don't have as much feeling. So not everywhere hurts as much. I'd say hamstring injuries don't tend to hurt as much. Feet hurt definitely a little bit, but it's all to your level of tolerance. We are not going to turn it way up if you're not going to be able to sit still and manage the treatment. So it is to your tolerance. We do about 4,000 pulses, 3,000 to 4,000 pulses is typical for a treatment. That's kind of what research has shown to be beneficial. Treatments usually are 3 to 7 days apart. Most areas respond to a series of treatments, so it's not a one and done. You may need 4 treatments, potentially 8 treatments to the area, depending on how long you've had the issue going on. Side effects. Let's say we see very few side effects with it. It's a non-invasive, very safe treatment. You can be a little bit sore from the treatment. Basically, it can do what we call apoptosis, which is cell death to damaged cells. So let's think about those cells being squeezed again. Let's say that cell has some damage. That cell is going to burst. So it helps clear out some of the debris, some of the damaged cells in that area. So we'll see some pain, kind of like a dull aching pain, typically after the first treatment and less after further treatments. It typically does do a pain reduction because it is a slightly painful treatment. It overstimulates your pain receptors, so you'll notice a decreased pain in that area for the next maybe 24 hours. So that's nice to have. It does not mean it's healed, and it's one of the things that we'll warn people on, like, hey, we did this, you might feel less pain. Please don't, let's say it's, plantar fasciitis, don't go jump roping barefoot right afterwards just because it feels better. So treatments, depending on the speed that we're administering the pulses at, it might take anywhere from 4 to 10 minutes. So pretty short treatment. And then we love to do rehab afterwards, kind of what exercises are going to help strengthen the tissue, help you build resilience and tissue tolerance again, so you can get back to doing what you love. So again, that's a brief synopsis of shockwave therapy, the difference between radial shockwave therapy and focused shockwave therapy, which is what we have here, what it can help with. Again, that is tendinopathy, so that could be Achilles tendinopathy, tennis elbow, golfer's elbow, high hamstring tendinopathy, hamstring tears, muscle tears in general, scar tissue. It can definitely help mobilize and break down thick scar tissue, and then it can help with bone healing. If you have a non-union fracture, it helps build up that bone so that it can heal quicker.